Hello, guests and judges. This is Team One's health case competition solution titled Mind the Gap. As we all know, Amina Khalid is a 33-year-old unsponsored refugee living in Woodstock, New Brunswick, with her husband and 3 children. Being an unsponsored refugee, Amina struggles to find a support system to build what most people would call in Canada a holistically healthy lifestyle. In this slide, we will address how we would have handled the immediate situation had we been Amina's healthcare team. This does not include our 3-year solution. As her healthcare team, when a language barrier is noticed, there would have been extra precautions as misinterpreting physical symptoms can be harmful to a patient. When an interpreter cannot be located, we would have reached out to resources discussed later in the slides instead of giving up and using Google Translate. Language discrepancies may result in an increased psychological stress and medically significant communication errors for already anxious patients. When the lively children are noticed by the hospital staff, there should have been a social worker assigned to her case in order for Amina and her husband to be able to concentrate on Amina's medical needs and reduce the stress of keeping the children occupied. There seems to be a staff-to-staff and staff-to-patient communication problem. Failure to communicate properly has serious risks with negative consequences. Patients may fail to comply with instructions or elect not to have potentially life-saving treatment. Anytime a patient is in distress, it should be noted in the medical chart and reported back to the physician, along with making the patient aware that their plan has been heard and will be reported to the physician. The physician does not tell Amina which symptoms to be aware of, and if they increase, to come back into the ER. This is problematic due to the lack of reinsurance and understanding, which we would have avoided. Through evaluating the case, challenges were identified. There's lack of transportation, miscommunication, lack of internet access, the rushed consultation, the lack of emotional support, the availability of language interpreters, lack of resources for children, and the cost of healthcare. We have condensed these challenges into 4 main solutions, which are language barriers, socioeconomic status, lack of social and emotional support, and lack of cultural compassion.
Based on Amina's situation, we have compiled a series of 4 initiatives to implement over the span of 3 years that will enhance the New Brunswick healthcare system. They are an inclusivity audit, enhancing the pre-existing volunteer programs, creating a resource directory for healthcare providers, and the development of a transition and assistance app for people who are new to healthcare in New Brunswick. Let's take a closer look at them. The first solution we would like to share with you today is an inclusivity audit. An inclusivity audit is a qualitative diagnostic methodological process that reveals how bias manifests within an organization's practices and cultural norms. In our case, an audit would identify challenges faced in the healthcare system to reveal how biases manifest and impact healthcare in New Brunswick. This plan will be executed through the hiring of a third-party organization to conduct a cultural audit of the New Brunswick healthcare system. After analyzing the results, a representative and equitable review committee will be created to target the identified gaps in the system, specifically pertaining to those who experience cumulative deprioritization, including people of low socioeconomic status and people who face language barriers. A value statement will also be edited and released to hold the healthcare professionals accountable to their development and learning. The impact of this audit will be plentiful and will influence healthcare workers to be people who understand their own culture, appreciate cultural differences and others, and incorporate this knowledge into their interactions, thus being able to provide all patients with the highest quality of healthcare while addressing inequality issues in the healthcare system. To fully analyze this solution, we have researched the strengths and limitations in our proposed idea. Strengths include the audit identifying weak points in the New Brunswick healthcare system, which helps us move forward. And another strength is the values statement, which holds professionals accountable by changing workplace and New Brunswick health culture to support needed progression. Some limitations include challenges addressing the outlined issues, as there is a possibility that there may be some unwillingness to accept identified challenges in the healthcare system. A second solution that we present to you is an enhanced volunteer program. Patients who do not share the same first language as their providers have reported lower care satisfaction, and it has also been shown that patients with lower socioeconomic status receive less information about the diagnosis process, and there is a lack of direction from healthcare professionals. Enhancing the volunteer program alleviates background issues that patients face, such as childcare, understanding how to access resources, and finding their appointments. Oftentimes, healthcare can be rushed in New Brunswick due to lack of providers, and this is especially the case for people of lower socioeconomic status. Currently, volunteers in the New Brunswick healthcare system visit patients, assist with recreational activities, greet and assist the public, and participate in hospital or care center-wide activities. Upgrades to this program would include training sessions to broaden the scope of their volunteer work. They would partake in tasks such as explaining resources, following through with patients after a consultation to direct them for more clarification help if they need it, and assisting with childcare while patients are being seen, as well as more based on demand. This program will also decrease volunteer turnover rates as the volunteers are additionally provided with leadership opportunities. An enhanced volunteer program would provide patients with increased opportunities to access quality care, as there will be more help directed to making their visit holistic and intentional. This will be accomplished by enhancing volunteer preparation workshops and through the expansion of volunteer recruitment programs. Additionally, we advise educating healthcare professionals about the availability and capabilities of volunteers so they are utilized to their full capacity. The strengths and limitations in this solution are as follows. Strengths include utilizing existing services and providing higher quality care with less background distractions. Some anticipated limitations may include additional volunteer training time needed, so the volunteers take longer to go into the system, but we think that the payoff is worth it. Our third solution is a resource directory. This is an initiative to help healthcare providers access supportive resources in one collective database, and ensures that there is consistency in the resources being distributed across New Brunswick. The program will be particularly influential in increasing the quality of care for patients of low socioeconomic status and those who face language barriers, especially when the provider is not familiar with the specifics of their experiences. This directory will be used to support healthcare professionals in delivering higher quality care. The directory will be available online for easy access and will be updated with current numbers and information when they become available. Strengths of the directory include promoting existing services, as the available resources are already in use in New Brunswick, and allowing for higher quality care, especially to vulnerable populations. A potential limitation may be the need to create a usage guide and promote the material to healthcare providers to ensure effective use. However, we are not concerned about this. This is an example of some services we would recommend including in the directory.
As a part of our 3-year program, we designed and developed the idea of transition and assistant app called NVComer. Features like support group and emergency helplines are designed to make newcomers feel safe in our New Brunswick community. The app will be available in 8 different languages, has a resource directory and a search bar to find the correct and available resources. It also assists health professionals in translation. The main goal of the app is to provide free access and resources to social support. The slides you will be seeing are the screenshots of front-end design that have already implemented. Safety and security are our top priority. So to ensure that the user must log in if they have to enter any sensitive information. This is our menu and language selection page. We have tried to make the icons of the menu as big and clear as possible. So just by looking, you can know which page you're going to. And the language option is the only one in red, so that it's clear, so that it's easier to remember. By the end of 3 years, we plan on having this app in 8 different languages. According to Statistics Canada, apart from English, these are the 7 most spoken non-official languages in recent immigrants in New Brunswick. We would further expand the translation in other languages after the launch of the app. The languages are listed both in English and in their languages. The speaker button can be pressed if the user wants to hear the language instead. We will provide a helpline for newcomers, as you can see in the slide, and health professionals, which can be accessed without the app. The helpline will provide entire and additional services that cater towards the need of newcomers. This eliminates the need of internet to access our services. During our research, we found that the biggest problem refugees face is lack of health records. To solve this problem, we have created a QR code application form. The refugee signs off for this program before entering Canada, and all their health information is stored in the QR code. The QR code can only be accessed by health professionals. This is our resource page. It has search options that cater to the needs of health professionals and newcomers. It links to free services provided by the app and other organizations. Canada is a welcoming country, and there are numerous resources and services to assist refugees, but the services are often unknown to refugee and health professionals. We want to eliminate that by using our resource base. A health professional can find services like translation and interpretation through the app. And newcomers can find services like support groups, discount coupons, and volunteering opportunities. For the support group, we will collaborate with various local NGOs and INGOs like the Multicultural Association. Anyone going to the support group with a car can volunteer to pick up other members without a reliable transport, and the information can be seen in the app itself. The resource directory can be accessed by both parties. The last feature we have is the ride share. This is one of the part of our volunteering program where the volunteers give refugees a ride to necessary services like groceries, stores, and hospitals. This is the 3-year timeline for the app with these steps, that is planning, front-end and back-end development, and translation of the app. We can complete and launch the app in 2 years and provide post-launch support and improvement for the next 1 year.
In order to address the fact that the progress needed to help refugee communities in New Brunswick extends beyond the 3 years needed to put our plan into action, as well as to have our plan be more sustainable and accountable to its goals, there are 3 assessments we would like to put in place. First is a statistical analysis of the NBcomer app, where data on its users and usage, as well as usability, can help understand the needs of newcomers in New Brunswick and give direction to updates that better meet the needs of the community. Our second assessment is the administration of quantitative patient surveys. These voluntary anonymous surveys would collect patient opinions on their quality of care and the cross-cultural understanding exhibited by healthcare provider, which help direct changes made to the Inclusivity Committee and their work. Lastly, an Inclusivity Committee quality assessment would be administered by the third-party group hired to administer the Inclusivity audit. They would provide recommendations to the healthcare provider based on the progress they've made after 3 years. This assessment, alongside the patient surveys, will guide changes to committee work as well as the healthcare provider's value statement. These assessments and ensuing changes are important to continue to improve health outcomes of refugee communities and create systemic change in the healthcare system. With all that laid out, the timeline for the 3-year plan comes out looking like this. With careful planning and monitoring, the plan is attainable and allows a wide scope of challenges to be addressed in a timely manner. Amina Khalid's case shows us the inequalities and great gap in the healthcare and health outcomes of refugees in New Brunswick. The big 4 challenges we outlined previously, language barriers, socioeconomic challenges, social emotional support, as well as lack of cultural compassion, are in no way small or easy challenges to tackle. But through the development of the NBcomer app, which provides supports in many languages, as well as a resource directory for physicians to access resources for translation services and cultural services, the language barrier can be bridged. The app's ability to operate offline through a phone call, as well as its free access to resources, allows people of lower socioeconomic status to control their healthcare without fear of financial repercussions. The physicians' resource directories, as well as the app directories, help refugees gain access to incredible resources such as multicultural centers and support groups that really help with finding strong emotional support systems. And the inclusion audit, as well as the expansion of the volunteer program, would help bridge the gap in cultural compassion. Based on our recommendations, we believe that New Brunswick healthcare system has the potential to offer the highest quality healthcare to its patients, and we as a team look forward to helping shape a more inclusive healthcare system for all. Thank you so much for your attention today. We really enjoyed having the opportunity to collaborate and shared what we worked with you. We would love to answer any and all of your questions.
That was awesome. Now the judges have 10 minutes to ask their questions.
Well, thank you for the presentation. That was great. One quick question, and then I have a more broad question thereafter. But the first one was with respect to the inclusivity audit. You talked about looking at having a third party administer this audit, correct? Yes. Okay. I saw some heads nod. Now you have to ultimately determine who this third party is. And of course, you know, if you wanted to go of grand schemes, you could go with, like, you know, I don't think McKinsey Consulting is going to be within that perspective, but let's say they are. But alternatively, you could have that type of, you know, powerful type of consulting firm come in to look at something like this. But the concerns here from the inclusivity audit are largely with respect to newcomers and really just a grand kind of side of things of socioeconomic discrepancies, and also just pure concerns over discrimination. So how would you go about deciding which third party is going to administer this type of audit?
Basically, what we would be doing is we are looking for three main things: so equity, diversity, and inclusion. And we would find those through a third-party legal group or law group of the highest standards, as this is Horizon NB and other hospitals throughout Horizon. And we believe that the quality of this, the quality of the audit cannot be needs to be of the highest standards. And so basically what we would do is assess the legal groups or any consulting groups to see which one has the highest standards of equity, diversity, and inclusion.
Okay, great. That's good. Thank you. And my second more large question is, you know, this app looks really cool, and I'm sure if you brought this, you know, to a boardroom, if you brought this in front of a group of people, they're going to be impressed. The layout was excellent. The question that you're going to get, though, is how much is this going to cost?
Yeah, so I thought of it. So the front end part that I have made is like in an actual app development platform. So from there, the cost of front end has decreased. And even if you move forward, I would volunteer like more of my time in for the front end and for part of the back end. So that would reduce the cost. And afterwards, we are thinking of around 30K.
30,000 per year?
Yes, not per year, for the whole project. Because
okay.
The approach, we have not discussed much in the plan, but the approach that I want to take is I kind of want to empower like first year computer science students or like fresh or refugees who have just come in. And I think being a third year computer science student, I have some knowledge and I have some work experience too. So my main goal would be to also like to train youngsters and to make them do it, so that we also reduce the cost in that way.
Good, thank you.
No worries.
I'll ask an additional question then. I really like your presentation as well. I thought it was nice and clear, succinct, and it was nicely mapping, you know, some issues onto solutions. So I really enjoyed that. The question that you probably will have thought about suggesting to develop an app is, how many refugees will have smartphones that have the capability of using apps?
That's a very good question. So to eliminate that, we have a phone line. So if you just call in the phone line, all the services that we are providing, all the services would be there.
And they can be accessed from a landline as well. You don't actually need to have a smartphone. It can be accessed from any type of phone, almost in the same way that you use one of those, you know, like you dial in, like press 1 for this menu, press 2 for this. That's the kind of option that is provided, and it doesn't need to be accessed with a smartphone with internet capabilities.
As well, our resource directory will be implemented on a platform physical base for handouts.
Yeah.
Yeah. So,
Just-
and just to clarify, so just one more point.
Yeah.
So the idea of the app is just to bring all the services there, but the app itself is not the services. We just want it to be a bit more easier because there are so many services, like, and it's all over the internet. So we thought it would be easier if there is one platform and they could just go through it.
Sure, I understand the idea. It's a one-stop shop for all the different services available. That's great. I mean, it does implicitly suggest that if you want to access the services, you would need to have some sort of phone or at least an internet connection, or at least a landline. But those are issues that are always going to come up if you use technology-mediated solutions to issues. Another question I have is, so let's say you develop an app and you have an app and all the things that you want to be in there are in there. How will you make sure that people actually use the app? Because we know that, you know, if you look at your own smartphone, there's a lot of apps. And if you think about how many you're using, 20% maybe on a regular basis, at least. So how will you make sure that this app, out of the however many they have on their phone, will be actually the one that is going to get used?
Yeah.
I can answer this one, Ojasvi.
Okay,
Okay, so part of our plan as well included the resource directory for physicians and healthcare providers. So implementing that and like having healthcare providers advocate for the use of this app is a great place to start. But that does require that people would have to go in and see a healthcare provider initially. We also mentioned though that with the app, we would like to partner with NGOs like the Multicultural Association, and we would be dependent on our partnership with them for promotion on their behalf. The tool is intended to be kind of like an overview of using the healthcare system. So that would be something that would be provided in information packages when people arrive in Canada or in New Brunswick, and could also be provided before they come to Canada, because it also is intended to store medical history that can start as soon as you are preparing to come to Canada. So essentially our partnerships with other organizations that are bringing people to Canada and helping refugees and newcomers, we would be reliant on them to support the promotion of the app and the phone lines.
Okay, so that was a beautiful answer to the issue of how do you get the app onto people's phones. Once the app is on people's phones, how do you get people to engage with the app?
Okay, I think that one of the best ways, something that we discussed, and everyone can add in at any point, but basically the accessibility of the app, the fact that it's a one-stop shop, it's really easy to find all of the tools that you would need in addition to health access, getting to the hospital. There's also the rideshare that could be used for various other things. There's lots of support groups that could be for emotional and social support, absolutely, but it also might be something along the lines of like a cultural group or some sort of like food organization, anything like that. So having all of the resources in one very convenient package makes it a lot easier, and it's also a very usable app. So no matter what language, or if you speak one of the 8 languages that are most common in refugees in Canada, then it's easy for you to use, and it's also very clean and tidy when you use the app. There's big logos. So basically just the usability and convenience of having all of your things in one app would make it really appealing.
Okay, thank you.
Anybody else have any questions for us?
Hi. I don't really have a lot of questions now because a lot of my questions were already answered from the previous judges, but I just wanted to say that your presentation was excellent. It was clear, concise. I love that concept of the app. I think that's the way of the future, obviously, right? I thought it was excellent.
Thank you.
Thank you.
Something else you could really promote with this app is that in that physicians can QR scan, you're going to promote a cross collaboration, a natural promotion of cross collaboration among physicians, because they're going to see all the information, and this removes that kind of siloed effect. Well, we've got this on file, but we aren't able to see other stuff unless it's transferred directly to us. And we know that that doesn't always happen in the medical setting. In fact, one of the big issues in not just New Brunswick, but in many provinces is this kind of like issue of having fragmented files across physicians. And so there needs to be a better organization and a better sharing. And this app could achieve that.
Agreed.
Yeah, that was something that we had considered. We didn't include it in our presentation because it wasn't part of the guidelines, but Kate and I had spoken to some actual practicing physicians, and they were saying that one of the issues was that not only just within Canada or within a province, but especially like refugees coming from across borders, you know, one of them was telling us a story about how, you know, the refugee had like their medical check, they'd had their wellness exams done, and they were approved to come to Canada, but none of the results of those exams were able to be transferred as with them, and that caused them to have to double the procedure and double that wellness check once they got to Canada anyways, because they had none of that information. So the ability for that QR code application form to be filled while they're still in their originating countries really helps with that language divide and informational divide as well.
I might have one additional question. The resource database, the problem with resource databases is they go out of date, you know, the day after you launch it. So how will you keep up with all the services that are out there, that they're still, you know, timely, and how will the upkeep of that be maintained?
Well, in our slides, the most popular for resource database, whether you're a university student or refugee, would be like the Sexual Violence New Brunswick, CHIMO, all those, which are constantly being updated. But they are some of the leading resources of New Brunswick, which are quite handy to keep updated on. So that's why we would like our developers to keep updating those resource directories. And the only limitation of that is where our resource directory would be on paper for people who didn't have phones and stuff like that, and we're looking for the resource directory, is new prints every so months.
Just to add on that as well, we did mention that we wanted to conduct statistical analysis of the app, and that includes what people are looking for in the app, and we can use the information that we gather from that to inform the kinds of things that we need to include in the directory. So if we see that people are looking for a certain like a subject or a certain type of support more frequently, then we can be sure to add more resources if that's something that we find is important. But based on statistical analysis of our other programs, we can inform the types of resources that we really need to stay on top of.
Yeah, I think that's a good point, because my thinking was like the resource database and the app, they're largely overlapping in terms of the solutions that they offer, right?
Yes, some of the resources, however, are more specified to physicians. For example, there's an interpretation like teleservice that is only available to physicians, and we wanted to keep that separate from what was available to the general public, so that different resources were still, you know, like things that aren't available to the general public, we didn't want to, you know, like if somebody's going to call the clinician hotline, it doesn't very much help the physicians who are actually trying to reach that hotline either. So keeping those separate and keeping those resources available for physicians to refer to their clients as well is a way that we wanted to keep it separate.
All right, guys, that was awesome. Thank you to the judges and Team 1. The question period is now over. And I'm sorry for the noise in the background. Everybody leave Zoom and go back to gather. Oh my God, I'm so sorry for the noise in the background.
Thanks everyone.
It was great.
Thank you so much. Appreciate it.
Thank you.